Child malnutrition. There can be serious effects for children when there are deficiencies in their nutrition. Let's explore a few types of nutritional concerns. Wasting. Children in developing countries and countries experiencing the harsh conditions of war are at risk for two major types of malnutrition, also referred to as wasting. Infantile marasmus refers to starvation due to a lack of calories and protein. Children who do not receive adequate nutrition lose fat and muscle until their bodies can no longer function. Babies who are breastfed are much less at risk of malnutrition than those who are bottle-fed. After weaning, children who have diets deficient in protein may experience kwashiorkor, or the disease of the displaced child, often occurring after another child has been born and taken over breastfeeding. This results in a loss of appetite and swelling of the abdomen as the body begins to break down the vital organs as a source of protein. Around the world, the rates of wasting have been dropping. However, according to the World Health Organization and UNICEF, in 2014, there were 50 million children under the age of 5 that experienced these forms of wasting, and 16 million were severely wasted. Worldwide, these figures indicate that nearly one child in every 13 suffers from some form of wasting. The majority of these children live in Asia, 34.3 million, and Africa, 13.9 million. Wasting can occur as a result of severe food shortages, regional diets that lack certain proteins and vitamins, or infectious diseases that inhibit appetite. The consequences of wasting depend on how late in the progression of the disease parents and guardians seek medical treatment for their children. Unfortunately, in some cultures, families do not seek treatment early, and as a result, by the time a child is hospitalized, the child often dies within the first 3 days after admission. Several studies have reported long-term cognitive effects of early malnutrition, even when home environments were controlled. Lower IQ scores, poor attention, and behavioral issues in the classroom have been reported in children with a history of serious malnutrition in the first few years of life. Milk anemia. Milk anemia in the United States. About 9 million children in the United States are malnourished. More still suffer from milk anemia, a condition in which milk consumption leads to a lack of iron in the diet. This can be due to the practice of giving toddlers milk as a pacifier when resting, when riding, when waking, and so on. Appetite declines somewhat during toddlerhood, and a small amount of milk, especially with added chocolate syrup, can easily satisfy a child's appetite for many hours. The calcium in milk interferes with the absorption of iron in the diet as well. Many preschools and daycare centers give toddlers a drink after they have finished their meal in order to prevent spoiling their appetites. Failure to thrive. Failure to thrive occurs in children whose nutritional intake is insufficient for supporting normal growth and weight gain. Failure to thrive typically presents before 2 years of age, when growth rates are highest. Parents may express concern about picky eating habits, poor weight gain, or smaller size compared relative to peers of similar age. Physicians often identify failure to thrive during routine office visits when a child's growth parameters are not tracking appropriately on growth curves. Failure to thrive can be caused by physical or mental issues within the child, such as errors of metabolism, acid reflux, anemia, diarrhea, cystic fibrosis, Crohn's disease, celiac disease, cleft palate, tongue tie, milk allergies, hyperthyroidism, congenital heart disease, etc. It can also be caused by a caregiver's actions, environmental, including inability to produce enough breast milk, inadequate food supply, providing an insufficient number of feedings, and neglect. These causes may also coexist. For instance, a child who is not getting sufficient nutrition may act content, so that caregivers do not offer feedings of sufficient frequency or volume, and a child with severe acid reflux who appears to be in pain while eating may make a caregiver hesitant to offer sufficient feedings.